When facing the challenge of cancer, you want to make sure that your body has the best possible support for being able to mount an immune response as well as to handle the treatments that you're exposed to. And so nutrition is foundational in that sense. It creates the groundwork for everything else to work better. Treatments work better, recovery from surgery is easier, chemotherapy can be more effective, radiation treatments can be more effective, and your body's ability to tolerate those treatments and to get through those treatments is markedly better because of nutrition. So food creates the conditions in the body that allow you to either thrive or decline. And food is interacting with everything else. It's interacting with your exercise, it's interacting with your supplement regimen, with treatments. And for example, in the realm of supplements, if you're taking a fish oil supplement but you're eating a tremendous amount of fats that work against that, the supplement just won't work. The fish oil won't do what it's supposed to do. The same is true with many herbs. If your diet is imbalanced or inappropriate, you will not benefit from that herb. So supplements work with food and food works with supplements. My approach focuses on finding the best fit nutritionally for each person. You need a balanced functional approach to nutrition, one that includes sometimes testing to make sure that you're not missing some deficiencies. For many of the people I work with, I find that getting a good history and finding out what their patterns have been for a long period of time is all that I need to really determine the best nutritional strategy. Simply giving people tools, self-care tools that help them feel and function better on a daily basis when they're facing such a difficult diagnosis is the first step toward authentic hope, toward establishing authentic hope. Not some kind of whimsical expectation of the future, but a real grounding in a hope for a better life and being able to live a good life despite this diagnosis. And that is probably one of the greatest gifts of this work, is providing that through the self-care tools that I teach people. Well, the first outcome is just helping people feel and function better. The second is helping to reduce their fear and their anxiety, again, through these self-care tools. Often they sleep better. That's one of the best yardsticks or measures of helping people reduce their stress, is just sleeping better. Immunity, their immune systems function better, so they're less prone to infections and they're able to perhaps stave off recurrences of cancer. And I can help them greatly speed up recovery from surgery and from other treatments. Many times major surgery leaves people completely depleted, but with the right nutrition, they can often recover very, very well. Reducing the harmful side effects of chemotherapy and radiation is a real blessing. So things like peripheral neuropathy and digestive issues, immune dysfunction, all of those side effects can prevent people from being able to complete their treatment. So by mitigating those toxicities, people can get through their treatments better, and that's usually leading to better outcomes.
So I'm curious, are there any specific cases of people you've worked with that were given fairly dire outcome for their diagnosis of cancer that you saw through this integrative and nutritional approach, as well as the full mind-body approach? They had recoveries that were considered to be almost
miraculous. Yeah. I have seen men with very advanced prostate cancer do amazingly well with just nutritional and herbal strategies. Men who had cancer throughout their bones, in some cases also in the brain, and were able to eliminate that cancer with natural methods alone, without using any pharmaceuticals or high-tech medicine strategies. So it is very powerful medicine. Some cancers are more intractable and I think may benefit more from a combined approach. I have seen breast cancers that were very advanced and where the patient had stopped responding to chemotherapy and they had cancer in their liver, and with the right natural medicine strategy, I was able to get rid of those metastases in the liver. So there are methods that are called soft medicine methods that in fact have tremendous potential for eradicating cancer, or at least putting it in submission for a period of time. Intravenous therapies like intravenous vitamin C and alpha-lipoic acid can often help with the process of disease stabilization, so keeping the disease from progressing, and then in many cases it can also help prevent the recurrence of disease. So preventing a relapse is one of the important long-term goals for many cancer patients, and so with these kinds of therapies that I've learned about through working with these integrative medicine clinics, we're actually seeing people stay in remission much longer than they would be expected to. I've also learned through trainings, I've had trainings in intravenous vitamin C therapy at the Reardon Clinic, which is in Kansas. I've had trainings in macrobiotic counseling and the use of energy techniques like Reiki and Qigong. And all of these things can also help the person facing a cancer diagnosis. One of the outcomes that I have seen is that people are living longer than they expected. They're living better. They're feeling and functioning better. Their quality of life, their vitality is really markedly better than it was before their diagnosis, which is kind of a paradox for many people. And they're thinking, here, I have cancer, and yet I feel better than I ever did before. So not just surviving, but thriving after their diagnosis is one of the greatest benefits, I think, of this work.